Yes, we're together. If that's enough for you, it's enough for me. If time would stand still and keep me here this way, you know what, Lord, I was satisfied just being here with you. There's no explaining the love we share. It's just between us two. I can't stay away from you. You won't stay away from me. It's where I belong. And right now, I'm praising God all the time. Praising God all the while. Yes, I belong to you. And you belong to me. Lord, we're together. If that's enough for you, it's enough for me. And I just want to sing, I'm praising God all the time. Praising God all the while. Yes, I belong to you, and you belong to me. Yes, we're together. If that's enough for you, it's enough for me. Can I testify? I'm praising God all the time. I'm praising God all the while. Yes, I belong to you, and you belong to me. Yes, we're together. That's enough for you. It's enough for me.
Huh? Well, a very pleasant good evening and welcome to the Ken Rampersaud Show here on Island Zone Radio, supporting the fighters, admiring the survivors, remembering the taken, and never, never give up hope. Again, good evening and welcome to the Ken Rampersaud Show here on Island Zone Radio. It's a beautiful Sunday afternoon. It's 5 p.m. here now. And it's good to have you guys on. Today we're going to be talking about breast cancer. You see the sign there, breast cancer. You can see the background a little bit, but it's okay. I want to say hello to some of our viewers that's on. Geeta Rampersaud, she's on. My good friend Rajwa Ramdin, thank you very much. Ramdi Chan, it's good to have you on. Mamzel Raghubir, thanks for watching. Rishi, thanks for watching. Rajiv Nandalal, watching all the way from Mount Vernon. Sherry Baksh, thanks for watching. Priya Prasad, thanks for watching. Please, guys, please continue to share the page. You know, this is a very important topic we're going to talk about today, breast cancer. And don't be surprised, not only women do get breast cancer, men do get breast cancer. I know one guy, the president of North General Hospital, many years ago, he died of breast cancer. We know Beyonce's father died of breast cancer. We know 1 in 8 women in the United States will develop breast cancer in her lifetime, and 520 men expected to die of breast cancer every year. So one has to be very careful, and we need to take this into consideration. I've always believed that knowledge is power, and the more we know, it's better for us. Also, we know that there are over 3.5 million breast cancer survivors living in the United States. So there is evidence to show that, you know what, people will survive from breast cancer. And I'll tell you guys some of the things that they can do to survive breast cancer. Mortality rate has been declining since 1989, which is a good thing that people are living from breast cancer. And I'll tell you some of the things that you can do to survive this. Also, physical activities in women are 25% less likely to develop breast cancer than those who are inactive. So we have seen that, you know what, if you exercise, you can help yourself from developing breast cancer. More than 2.8 million people living in the United States are breast cancer survivor. Act now, as you know, breast cancer education and screening can save up to 30%, 37 lives every year in the United States, according to the World Health Organization. So I'm going to ask the DJ to play another song in just a minute. And when we come back, we'll be talking about breast cancer. As I said before, not only women get breast cancer, we have male men do get breast cancer, and a lot of them is expected to die. 520 of them is expected to die every year. I mean, approximate number, if you know what I mean. So I hope that you guys are doing good. It's a beautiful day today. A little chilly today outside. I was lucky that I'm home today. I get to do some brickwork in front of the house. I had to make something up, and thank God I did. And here I am now talking to you guys. So please continue to share the page. We're going to ask our DJ to play another song for you guys. In the meantime, please share the page so we can help other people to know what to look for if they ever get breast cancer. All right? Let's go. Is DJ ready?
Grammar.
You are watching the Ken Rampersaud Show here on Island Zone Radio and on Facebook Live. Thanks for tuning in. Let's see who we have. Okay, he is ready.
Send me the pillow that you dream of.
That's right, that's right. Send me the pillow that you dream on. Isn't that a beautiful thing, especially when we are young days? I see some wonderful people watching the program tonight. Guys, please continue to share. Shelley Backus, a very pleasant good afternoon to you. It's always good to have Usha Azimula all the way from Wisconsin. Good to have you on. I know that you normally watch the football with your husband, but thanks for watching the Ken Rampersaud Show here on Island Zone Radio. Also, Priya Prasad, thanks for watching. Good to have you on. Let's see. It's good to have Davis Singh watching all the way from Canada. Yes, Davis, I know who you are. I do listen to you on your other half sometimes. I'll have for you to send me some of your songs so that I can play it on my radio show too. So later on, I'll probably inbox you my email address so you can send me some of your songs. And the beautiful Devika Singh is watching. As you know, last week we had a very intense and very great conversation. We actually hitting, I think we over 7,000 people watched the show last week. So that's a good thing. Hope you and the girls are doing great. Also, the beautiful Michael Nalini Naidu. Good to have you on today. I'm glad that you're not having family over today so that you can watch me. Kumar B. Maniram, thanks for watching. Let's see, Priya said, I love this song, brought back memories from my mom, with her mom used to sing. Yes, Richie Kangu, thanks for watching. The Ken Rampersaud Show here on Island Zone Radio. Also, a very special young lady is watching, Miss Shamira Kimball. We work together at one of the jobs, and I have to tell you, I am so impressed with her. Please send some love for her. She is watching. She just passed her state board exam in nursing, and I'm so proud of her. I wanted to bring her on the show, but she is a kind of shy girl because you know what? She went through so much to pass this exam, and she is so determined. And so what's such a great role model for all of us. So, my dear Shamira Kimball, let me know that you're watching. Just a thumbs up. And I tell you, I'm so proud of you. I was in tears. Not, I wasn't crying, but, you know, a tear dropped in my eye when I heard that you passed the exam. And I'm always glad when young people can do well in life and to continue doing great things. I know that you will make a great nurse down the line. With your wealth of experience in psychiatry and in so many other areas. So good luck to you, my dear. Paro Ram, thanks for watching. Mona Bali, thanks for watching. Champalal again, and good afternoon. I would say happy birthday to my brother, and you can tell me who is your brother so we can say hello and happy birthday to your brother. Kayum, thanks for watching. My beautiful friend Sheila Mangar Singh, watching all the way from Suriname. And let's see, Patricia, thanks for watching. Kumar Ramdiwar Kumar, thanks for watching. Shelly Backus again. Champalal, thanks for watching. They are cooking some strong curry in the kitchen there, and I'm getting that smell here. And you know when they put that little pepper on it, burn a little bit. So hey, after the show, I'll have some good show. Also, my beautiful friend Sherry Baksh watching all the way from Pennsylvania. Good to have you on, my dear. Rishi, thanks for watching. Robin Hassan, thank you very much. Mamzelle, it's good to have you on again. Randy, thanks. It's good to have you on. Like I said earlier today, that we're going to talk about breast cancer. And sometimes we as men, we think that we men can get breast cancer. Unfortunately, that both men and women can get breast cancer, you know, and we're going to say, what is breast cancer? If you have boobs or know someone who does, which all of us does, or breast or chest, whatever you call it, you're likely to know someone, you know, the breast cancer basic, because there's a darn good chances that there's a person in your life who had it. And we all know probably someone who has breast cancer or in the future who will get breast cancer. Breast cancer is the most common malignant in women. About 270,000 cases are diagnosed each year, accounting for approximately 30% of all cancer cases, according to the American Cancer Society. Although it happens more or less often, men also can develop breast cancer, which is like 2,670 men diagnosed with breast cancer annually. In each of these people, their breast cancer began the same way. A roxane cell began to multiply in ways it cannot supposed to, eventually forming a tumor. And that's not a tumor, is a swelling there, okay? To really understand the different types of stages of breast cancer, it can help to have an image in your body where it starts and how it's growing. The main structure of the breast are milk gland, that's called lobules, the duct that carries milk, and fatty and fibrous tissue that makes up most of the breast. Most breast most breast cancers started in the glands or the duct. As we know, once breast cancer is found, doctor will give you a stage 0 to 4, depending on the extent of the disease, what the prognosis is, and which treatment will work best for you. Within each stage, there are further clarification or classification depending on things like the size of the tumor and the lymph node involvement, usually indicated by doctors with the letter A, B, and the C. For now, we are sticking with the main category, which is 0 to 1, 2, 3, and 4. And one of the things that I've said, and I'll say it again, the early detection is really the key of getting your treatment. The earlier you pick up that you have any kind of cancer, it's better for you, and your chances of surviving, it's great. And I'll tell you guys later on the percentage of these things. So let's talk about if you have stage 0, also called ductal carcinoma. The stage 0 are abnormal cells that form inside of the duct, and currently research suggests in many cases these cells will not grow any further or cause any problem for the patient. Some even consider this non-invasive form of precancerous. Let's say they catch about 20 to 30% of the time. These cells continue their out of control ways and push into tissues outside of the duct, and this is called invasive cancer. Unfortunately, there is no sure way to know which type of cancer you have, which is why we even went to stage 0. Breast cancer are treated more, as we're going to talk about. So yes, when you get stage 0, that's the best time to pick up that you have breast cancer. Your chances of surviving, it's very high. And then we go to stage 1, and this is the earliest possible stage of invasive breast cancer. At this point, the tumor isn't bigger than 2 cm or 20 millimeters and hasn't spent more than microscopically to under the arm lymph nodes. Cancer caught at this stage are curable and treatable. The 5-year survival rate, meaning the number of women who are living with this diagnosis, is incredibly, it's 99% of them survive. So here we see if you have 0, you have a good chance of surviving, excellent chance of surviving, and if you have stage 1, 99% of people will live and live a healthy life. Also, we have stage 2. These tumors are really trying to stake their claim. They are generally larger than 20 mm and may have spread into few lymph nodes under the arm. But deep breathe, the 5-year survival rate for stage 2 cancer is still reassuring at 85%. So like I said before, you want to catch breast cancer early. Early detection is the key. Stage 3, at this point, the tumor is likely pretty big, larger than 50 mm, and our cancer cells have made their way into several lymph nodes, either under the arm or as far as their collarbone. This stage also includes cancer that have directly invaded into the chest wall and have formed skin nodules or ulceration. Again, guys, early detection is the key, and I'm saying this so that we can get something in our brain to check ourselves, ladies especially. And then we talk about stage 4. After stage 4, I'll have DJ get a song for me, and then we'll talk about some of the signs and symptoms of breast cancer. Stage 4, the most advanced form of breast cancer, known as metastatic, has spread to the bone and or organs such as the lungs, the liver, and the brain. And when I say metastatic, or it metastasized to different parts of the body like the brain and so on, when you hear your doctor say that, you have to be very concerned, because here it is that your cancer has spread to different parts of the body. Like I said, the lungs, the liver, and the brain. The most difficult part about this diagnosis is that it is not considered curable. However, in most people, progression of the disease can slowed or even stopped by a series of medication, which we will talk about, and other treatment, and the disease become more of a chronic illness. Sorry. The 5-year of this stage is 25%, which we know it isn't easy to see, but here is what you can do, and you must do to remember that these stats, yes, they are scary, but you are not a number. There are women today who are living a good life with this stage of cancer. Also, it is very important to know ladies must be able to check their breasts, on a monthly basis before the menstruation or after the menstruation. You want to know like the baseline, and when I said baseline, what your breast normally feels like, at an early age. You touch your breast every month and see what it feels like. So when there is something happening there, something that's abnormal, I want to say, you will be able to pick up what's going on. So again, as I said, 27% of women with stage 4 will survive. The rest of them, unfortunately, die. And it is a sad thing, too, that when you get diagnosed with cancer, any form of cancer, one of the things that I'm certainly sure that you would worry and you would want to know what's really going on and how you can help yourself. But like I said, and it's good to know these things that I'm telling you about, because the survival rate actually is good, especially if you caught it at an early age. So always good to go at your doctor and check yourself out, okay? Let's go, DJ. And when we come back, we'll talk about some of the signs and symptoms of breast cancer. Let's go, DJ. You're watching the Ken Rampersaud Show here on Island Zone Radio. Oh, I love this song.
Jerusalema ikhaya lami ilondoloze uhambe nami zungangishilana Jerusalema ikhaya lami ilondoloze.
This song is especially for Shamira Kimball, who just passed her exam, a nursing exam. Let's go. And she could dance too. Diamond Vibes, a very pleasant good afternoon. Rupi, thank you very much. Hey, my good friend Henry Ratto. Marna Ramru. Yes, self-examination. My good friend from England, Kumi Kumi. I'm talking over the song so I don't get blocked by Facebook. My beautiful friend, Jerry Persson, all the way from Florida. Every one of my beautiful friends, please sing hello to. Oh, my good friend, Renee Simonet, watching. A very good afternoon to you, my dear. Mary Lou Ramdani watching all the way from Canada. I think I could dance with it after that show. I love to dance. Michael Lady Naidu saying good afternoon to everyone. Good evening. Jerusalem. I could see some of you dancing.
indawo yami ayikholana buso wami awukholana ilondoloze suhambe nami.
Miss Carlotta Haynes, good evening, my dear. We are talking about breast cancer today. All right, Priya says she loved this song too. Rajan Narayan, my good friend, my brother. Good to have you on. Me too, I love the song, Ramdani. Marianne Lou, love it. All right, looks like all of you guys enjoyed the song. I know Shamira was dancing. She and I used to dance at work sometimes. And it's good afternoon again. Welcome to the Ken Rampersaud Show here on Island Zone Radio. And we are talking today about breast cancer. You know, a lot of people get diagnosed with breast cancer, and I want to bring this forefront of what do we do and what some of the symptoms we are going to look for if you get breast cancer. I always encourage women to check your breast every month, and one of the good things to do is it wouldn't hurt you to check it a lot of times because you want to know what your breast feels like before menstruation, after menstruation, and you know, sometime around that time. Give yourself a baseline of what it is like, and you ladies know more than I do what it feels like. I'll pay more attention now when with Gita. And also men has a big role to play in breast cancer. As we said earlier, that men do get breast cancer. The president of North General Hospital died a couple of years ago of breast cancer, and it's surprising that you know, it does happen. So let's go with the symptoms. Signs and symptoms of breast cancer may include a breast lump or thickening that feels different from the surrounding tissue, change in the size, shape, and appearance of a breast. And that's why sometimes it's important to look in the mirror, breast, I'm talking about breast. Look in the mirror and check your breast and see what it looks like from an early age. So if there's any changes going on, you would know. Also, changes to the skin over the breast, such as dimpling, a newly inverted nipple, and if you guys may know what I'm talking about, inverted nipple, where your nipple go pull inside, not outside how it is, like peeling, scaling, crusting, and flaking of the pigmented area of the skin surrounding the nipple, the areola or the breast skin. Any changes you want to talk to your doctor. Also, redness or pitting of the skin over your breast, like the skin of an orange. And you guys know what an orange skin look like. If at any given time you notice or you observe that your breast looks like the orange skin at the top, you need to go to the doctor. And we want to know when really do you go to the doctor. If you find a lump or any changes in your breast, even in a recent mammogram, was normal. If you do a mammogram last week and you find that this week there's a change in your breast, please go to the doctor. Make an appointment with your doctor for a prompt evaluation. This would help you. As I said earlier, and I'll say it again, early intervention is the key for any kind of cancer. And what causes breast cancer? Doctors know that breast cancer occurs when some breast cells begin to grow abnormally. These cells divide more rapidly than healthy cells do and continue to accumulate the lump or the mass in the area. Cells may spread, and as I said, I'm going to break this down. When you heard the word metastasize, that means your breast cancer or any kind of cancer spread to different parts in your body, like your brains, your liver, your pancreas, and so on, to your lymph nodes or to other parts of your body. Breast cancer most often begins with a cell in the milk-producing duct. Breast cancer may also begin in the glandular tissue called lobules, or in the cells or tissue within the breast. Researchers have identified hormonal, lifestyle, environment factors and that may increase your risk of breast cancer. So we talk about hormonal, lifestyle, and environmental factors that may increase the risk of breast cancer. And we will talk about some of the things that you can change, like your lifestyle and the environmental factor. But it is not clear why some people who have no risk factors develop cancer. And I'm going to talk about a little bit about that. Sometimes you have your mother and your father, or you have a whole generation, your aunt and so on. Nobody has breast cancer, and all of a sudden you get breast cancer. Also, be it not clear why some people who have no risk factor develop the cancer, yet there are other people with risk factors never do. You may also have, like, your aunt, sister, your cousin with breast cancer, and guess what? You wouldn't get breast cancer. It's likely that breast cancer is caused by a complex interaction or by genetic makeup and your environment. And one of the things that I want to say to you guys, to you ladies and gentlemen, that if your family have breast cancer, let's say that your mother has breast cancer, your sister have breast cancer, it does not necessarily mean that you will get breast cancer. What I could advise you and tell you to do is that what you need to do, don't get worried anytime you feel a mass. You don't get worried. Go to the doctor, get yourself checked out, and when you finalize what's going on, then you need to worry, because we know that worrying kills. It causes stress, you could get depressed, and so on. Okay. And another thing I was going to say, if you're at that age, always talk to your doctor of when you should start to go to the doctor and check for breast cancer. Okay, inherited breast cancer. Doctor estimated about 5 to 10% of breast cancer are linked to gene mutation, and that's one of the things that you cannot really change. Pass through from generation of family to generation. A number of inherited mutated genes that can increase the likelihood of breast cancer have been identified. The most well-known are breast cancer gene BRCA1, which you guys don't need to know this. I'm just mentioning it to you. BRCA2, and both of which significantly increase the risk of breast cancer and ovarian cancer. If you have a strong family history of breast cancer or cancer, your doctor may recommend a blood test to help identify specific mutation in BRCA, which is 1 and 2, or other genes that are being passed through your family. So there's a special gene that passes through your family that the doctor will check for. Okay. Consider asking your doctor for several referral to a genetic counselor who can review your family medical history. And one of the good things is that you always want to know what are some of the diagnoses that your family has. For example, your mother, your father, your aunts and uncle. You always want to know a good history. When you go to the doctor, you be honest with them and let them know. And when I'm admitting patients, I always want to know what are some of your family history that you have in your family, and that would give you a good insight of what to look for sometimes. Like I said, not because your family have cancer, that means you are going to get cancer. A genetic counselor can also discuss the benefits, the risk and limitations of genetic testing to assist you with shared decision making. It's always good to talk to a counselor, and they will help you, and you want to be in the decision making with your cancer. You don't want people to make decisions for you, but it's always good to have your counselor to help you to make these kind of decisions. Okay. Let's see, we can get DJ to play another song, and when we come back, we'll talk about some of the risk factors that you're going to look for in terms of breast cancer. So ladies and gentlemen, thank you for watching the Ken Rampersaud Show. We'll be right back here. Good to have you on, Savitri Bailey. Thank you. I'm glad you're on. Imran Mohammed, Peer Baksh. Dennis Laker, I'm watching all the way from Canada. I'm glad that you're learning, Priya. You have a far way to go. You will have so many lives to touch in your generation. Marna Ramru, thanks for watching. Sharon Bacchus Satrahan, good to have you on. Continue to share your positive message every day. Supporting the fighters, admiring the survivors, remembering the takers, and never give up. Happy Sunday to you, Savitri.
And if you follow me, go now, enjoyment go kill 'em. Baby girl, you bad, girl, the way you whine. I demand over you, girl. I demand over you, girl. Say you are my woman, my superwoman. I demand over you, girl. I demand over you, girl. Die for the love, girl, I want me, she want for the love.
Last week's show generated over 7,600 viewers. And I want to say thanks to all of you guys for sharing the page and sharing that episode. Please continue to do so. Know that I really appreciate it. That's right. Please like and share. Good to have you on, Ken Rampersaud. Happy Sunday to everyone he's saying. As Savitri says, agree. Share your history with your doctor and know your family history. And a very good afternoon. You're watching the Ken Rampersaud Show here on Island Zone Radio. Again, guys, I want to say thanks for all your love and your support, and thanks for continue sharing my show. We're going to talk about some of the risk factors for breast cancer. A breast cancer risk factor is anything that makes it more likely that you will get breast cancer. But having one or even several breast cancer risk factors doesn't necessarily mean that you will develop breast cancer. And I want to say this again. There's sometimes I'm going to repeat something more than one time so that you would understand. Not because 5 persons in your family have breast cancer means that you are going to get it. Sometimes too that nobody in your family has breast cancer, but you will get it sometime in your life. Also, many women who develop breast cancer have no risk factors, as we have said before, factors that are associated with an increased risk of breast cancer includes being a female. You are much more likely than men to develop breast cancer, and I can tell you that 1 in 8 women will get breast cancer sometime in their life. Increase your age. You know, as you get older, you can get breast cancer. Your risk of becoming breast cancer increase as you age. A personal history of breast cancer: if you had a breast biopsy that found globular carcinoma, okay, and then we have atypical hyperplasia of the breast. So these things you have to watch out for. You really don't need to know this. I'm just saying this, and so when you go to your doctor, you may know exactly what they're talking about, and they will be able to help you. A personal history of breast cancer: if you had breast cancer in one of your breasts, you have an increased risk of developing cancer in both of your breasts. But please, I'm not telling you to go and worry that because you get cancer in one breast, that means you're going to get it in the other one. That does not necessarily mean so. it means that your chances of getting it has been increased. A family history of breast cancer. If your mother, sister, daughter was diagnosed with breast cancer, particularly at a young age, your risk of breast cancer is increased. Still, the majority of people diagnosed with breast cancer have no family history of the disease. Inherited genes that increase cancer risk. And like we have said before, if a lot of times we can't help what our family has and what they pass down to you, you have to live life like that. The most well-known gene mutation, as we said before, are referred as BRCA1 and 2. These genes can greatly increase your risk of breast cancer and other cancer, but they don't make cancer inevitable. Also, radiation exposure. If you receive radiation treatment to your chest as a child or the younger adult, your risk of breast cancer is increased. And that's why when you go for a chest x-ray, a lot of times you will see that they will put something like a sheeting over your chest to help you to get so you wouldn't be able to expose a lot to these kind of radiation that's in the room where you're going to do your x-ray or whatever it is. Also, obesity. Being obese increase your risk of breast cancer. That's why I have said many times on this show that one has to be very careful what you're eating. And you know what? We are being educated more now that, you know what, it could help us watch our diet. It is important to eat food that will benefit us, especially when we become a little older. We eat what is good for us, and that's what bad for us. Beginning with your period at a young age, before 12, increase your risk of breast cancer. So we are saying that if your period start before 12 years old, there's an increased chance of you getting cancer. Beginning menopause at an older age. If you began menopause at an older age, you are more likely to develop breast cancer. Again, does not necessarily mean that you are going to get cancer. Having your first child at an older age, women who have given birth to their first child after age 30 years may have an increased risk of breast cancer. Having never been pregnant, women who have never been pregnant have a greater risk of breast cancer than do women who have had one or more pregnancies. Also, we have postmenopausal hormone therapy. Women who take hormone therapy medication that combines with estrogen and progesterone to treat the signs and symptoms of menopause have an increased risk of breast cancer. The risk of breast cancer decreases when women stop taking these medications. So if you don't have to take it, please don't take it, okay? Also, we talk about, we know that alcohol is no good for you. So drinking alcohol increase your risk of getting breast cancer. But I'm not saying that you should not be drinking, but please, by all means, drink in moderation. And that's something that I do. I drink probably once or twice a year, and that's about it. You know, how do we really prevent breast cancer? I'm going to let DJ play a song, and when we come back, we will talk about some of the things that we can do to prevent breast cancer. I'm good to see my friend Nelson Salgado. How are you doing, my friend? Savi Bangaru, thanks for watching. Golin, thanks for watching. A very good evening to you too. Sisto Sunarine, thanks for watching. And Priya says can't pass hits on injury causing breast cancer. Devika Singh, Rajesh Singh, thanks for watching. Let's go. And our good friend Maria is watching. I want to say, Maria, very pleasant good afternoon to you. As you guys know, Maria is one of the admin on the Ken Rampersaud Show. She is going through a little tough time now. Her dad is sick. I think is in Guyana. I'm not sure. And you can say, my dear. But please, guys, let's pray for Maria that her father recover well. I know she said he nearly passed away last night. So let's support her. Let's put our arms around her and say a prayer for her. It's good to have Eddie Ramlal on the program. Also, Pamela Jeffers Sanchez watching all of you in Pennsylvania. Good to have you on. Let's go, DJ, with a nice song. Know that we love you, Maria Harris. We are praying for you. Good evening, Drupati Pokan. Good to have you on. You're watching the Ken Rampersaud Show here on Island Zone Radio.
I ask her where she from, she tell me in the topics. She asked me what's my name, I tell her I am Connie. And I said, girl, tell me what's your name. And she tell me that her name is Jamaica. And I said, smile, girl, smile. Smile for me, Jamaica. And I said, smile, girl, smile. Ooh, Lord, smile for me, Jamaica. Never you cry, here am I. Yeah, I'm here for you, Jamaica. Dry your eyes, girl, smile. Smile for me, Jamaica. Lord, hey, she have a rich history. A beautiful woman with the sweetest.
Well, it's good to have Nasir Hussein watching all the way from Florida.
Of a nice sunset on the evening season. But she tell me, say she tired. Tired of the exploit and the liars. She give them reggae, give them beaches, give them flowers and the ferns. All she got is abuse in return. But I say, don't you worry yourself, mama.
Stay on, Nasir, I have something to say. Don't move.
Don't worry yourself, mommy. One thing me I beg you do for me. And I say smile, girl, smile. Smile for me, Jamaica.
Good to have my good friend, singer from Florida, Miss Shirley Prasad, our content. Chandel Garrett, thanks for watching. Good evening to you too, Triple T Token. Big Well Halal, good afternoon. Thank you very much. And you are doing a good job to Big Well. Sharing all them good food. Cooking all them good food.
But see ya, them must think you say you're out of ideas. You give them art and sweet literature. You're gonna make the world see the better picture. I said no worry yourself, mama. Chronics is here to your help, mama. Hey, I said no worry yourself, mommy. One thing me I beg you do for me. And I said smile, yeah, smile, boy. Smile for me, Jamaica. And I said smile, yeah, smile, wah, 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 wah. Smile for me, Jamaica. Never you cry, here am I, whoa. Here for me, Jamaica. And I said smile, boy. You made it for me, boy, yeah.
Good afternoon and welcome back to the Ken Rampersaud Show here on Island Zone Radio in New York and on Facebook Live. You know, I have a very special guy on this program and I want to say hello to him, as I know all of you guys are special, but I'm always grateful to this family, Nasir Hussein. When I came to the United States many years ago in 1990, I'll never forget it. It's right back in my heart and it's my brain. You know, when I migrated to the United States many years ago, I was going through such a hard time here. I did not know where I was going to sleep the next day. And this guy and his family, the one who sheltered me here in New York when I had nowhere to go. So ladies and gentlemen, please big up this guy, Nasir Hussein, and let him know that you guys appreciate it and I'm way this far. So on behalf of myself and my family, Nasir Hussein, I'd like to say thanks to you and your family for helping me here in New York. Because of you guys, I am where I am here in New York. You're watching the Ken Rampersaud Show here on Island Zone Radio. And let's go. We have, and so Big Well Halal, thank you very much for your kind words. It means a lot. And please, guys, do support Big Well Halal in Queens here, Liberty Avenue. I know Shanaz Hussein always speak well of them, and she does buy their food. Okay? Again, guys, please support Big Well Halal. Kumi watching all the way from England. Savitri Bailey, thanks. Good to have you on. And how can we prevent breast cancer? Can we really do that? And we're going to talk about it. Making changes in your daily life may help reduce your risk of breast cancer. One of the things you try to ask your doctor about breast cancer screening. As I have said earlier in the program, one of the best things that you can do for yourself, and I'll repeat it again, is you want to touch your breast, you want to palpate your breast and know what it feels like on a monthly basis. If you're young, you don't have to do it. But as you get older, but you want to know the baseline of what it feels like, what your breast feels like. Discuss with your doctor when to begin breast cancer screening, exams, and tests, such as clinical breast exams and mammograms. And the truth of the matter is, early detection, like I said, early detection is the key of your survival rate. Together, you can decide what breast cancer screening strategy are right for you. Becoming familiar with your breast through self-examination for your breast awareness. Women may choose to become familiar with their breasts by occasionally inspecting their breasts. I say another good thing to do, like I said before, you want to go in front of a mirror and see what your breast looks like. And so when you get older, if something happens, you see something out of shape, you can make sure you go to the doctor, and you want to do so soon. If there's a new change, lump, or any unusual sign in your breast, you want to talk to your doctor promptly, and you don't want to waste any time. Like I said, early detection is the key. Breast awareness can prevent breast cancer, but it may help you to do a better understanding of the normal changes that your breasts undergo. And I know that you ladies know that sometimes during your menstruation, your breasts may feel a little different. You may feel a little lump in there. So it's a good thing to know what your breast feels like, okay? We also know that drinking alcohol in moderation, if you have to drink at all, limit the amount of alcohol you drink to no more than 1 drink a day if you choose to drink. But I know that people do drink much more than this. But if you want to live a healthy life, you take a little drink here and there. Exercise most times of the week. Aim for at least 30 minutes of exercise on most of the day of the week. And I've always told people, I've told my patients all the time this every week, every time that I meet with them, try to exercise at least 30 minutes per day. If you can't make it to exercise 30 minutes a day in one thing, you just go and exercise every 15 minutes. Not every, like 15 minutes, 15 minutes in the morning and 15 minutes in the afternoon. So that will help you. And we talk about diet also. Try to eat a balanced diet. Eat food that's going to help you and is going to benefit you. Too much beef and pork is not good for you. And, when you eat a balanced diet, it's good for you all over the area, like good for your cholesterol and so on. If you haven't been active lately, ask your doctor. You want to ask them what is okay to do. And I'm not telling you to start running. Go start running tomorrow, like 10 miles. One of the things that you want to do always, you want to start slow, and every day gradually you start increasing whatever you're doing. Let's say that you're walking a mile today. Tomorrow you can start a mile and a half. The next day you go 2 miles, okay? Limit postmenopausal hormonal therapy, which you can talk to, your doctor will discuss with you. Combination of hormone therapy may increase the risk of breast cancer. Talk with your doctor about the benefits and risk of hormonal therapy. Some women experience bothersome signs and symptoms during menopause, and for these women, the increase of risk of breast cancer may be acceptable in order to relieve the menopause signs and symptoms. Yes, women do go through a lot of things, especially during when they're going through their menopause. And I know a lot of elderly women watch my show, a lot of older women who pass through their menopause, and you guys know you go through a lot of things. But if you are going through a lot of stuff that's making you uncomfortable, like the dizziness, and you need to get hormonal therapy, talk to your doctor, let it help you. And it's good to take it, because guess what? In the long run, it's going to help you. But sometime down the road, you may want to stop taking it. To reduce the risk of breast cancer, use the lowest dose of hormonal therapy possible for the shortest amount of time. You want to maintain a healthy weight. And when you do that, what you have to do is, like I said before, you want to add exercise to your daily program. You want to eat a balanced diet and to help you. And if your weight is healthy, all what you want to do is work to maintain that weight. If you need to lose weight, ask your doctor about what's healthy strategies to accomplish all of this. Another important thing to do is that, especially in the United States and in Canada, you have people who can help you, dietitians, who can help you in choosing a diet that is good for you. And you can ask your doctor what is to help you get onto a dietitian so they can help you eat food that is good for you. Choose a healthy diet all the time. I tell people, and they said women who have eat a Mediterranean diet supplemented with extra virgin olive oil and mixed nuts may have a reduced risk of breast cancer. The Mediterranean diet focuses mainly on plant-based food such as vegetables and fruits, whole grain, legumes, and nuts. People who follow Mediterranean diets choose healthy fats such as olive oil, like I said, over butter and fish instead of red meat, as we know. And some of the good fish that we have that we can eat, things like salmon and mackerel, okay? And also we know that fish is good for you in terms of for your cholesterol if you have any kind of cardiac problems. So let's go. DJ is going to play another song for us, and when we come back, we will continue the discussion. Okay, guys? Please don't forget to share the page. You're watching the Ken Rampersaud Show here on Island Zone Radio and on Facebook Live. Let's go, DJ. One of my favorite songs. Good evening to my sister in Canada, Miss Anita Ishdaulat Ram. Yes, it's my biological sister. She's smaller than me. Good evening to Alvin Ramsarup. The underground songs from Schenectady, New York. Well, a very pleasant good evening to all of you watching the Ken Rampersaud Show here on Island Zone Radio and on Facebook Live. I see someone who's very special to my heart, and that is Sushila Devi. As you guys know, that Sushila is such a great singer. I know she's teaming up with a lot of singers from India. So you are doing a fantastic job representing Guyana at its best. I love your voice. So many singers on tonight. We have Girlie Passad, that's in Florida. I'm so proud of all of you ladies, doing a fantastic job. When I see you guys and hear you guys sing, I am like, yes, I am a Guyanese, and they are Guyanese too. So Sushila Devi, you know how much I love you, like cook food. Also, I have the beautiful Dr. Veronica Jackson-Wiltshire. It's good to have you locked on to the Ken Rampersaud Show. I love you too, and it's good to see you on. I always wonder how you are doing, and I'm so glad that you are. I hope that you are safe during this pandemic. Can't wait for you to come in the studio so we could have some great discussion and help our community. So, ladies and gentlemen, I'm so glad Dr. Veronica Jackson, always love her and big her up. My very good friend John Namat, all the way from Suriname. Good to have you on, my brother. Michael Nalini Naidu, good to have you on. Jack Lorraine Kingston, good to have you on. Guys, please continue to share the page. Let's see, Bibi Hack, my good friend too. Good evening to you. And she's saying good evening to Mari Harris. You know, when I look at the page and I see so much of my good friend, I can't help but think how blessed and honored I am to have you guys as my friend. So much of you I know personally. Also, I want to big up the Nalini, Neela Pawaru Narain, a very good friend too. She is with the Caribbean Voice, and so a woman who is very dear to me. If there is something that's bothering me, I can always call her or write her, and she will give me the best advice. The other good thing that she does so many things in Guyana, and always a generous heart. So we pray that God will continue to bless people like Neela Pawaru, and to all of you guys here who's locked on. So Maria, good to have you on again. John Namat. Let's see, we have Nagita Sanyasi watching from Guyana, Virgin area. It's always good to have you on. My Nanda P. Hemraj, she's saying, good afternoon, Ken. I am at work listening. Good. I'm so glad to see so many ladies on watching the program, and I hope that it would help you guys. If I can save one life today, I am good enough. The beautiful Vimala Prasad, Miss Florida, is watching the program. Good to have you on. Always sexy mama, and always good to have you on the Ken Rampersaud Show here on Island Zone Radio. Let's see, we have Yogita Raman. Thanks for watching the show. I always like to acknowledge you guys. Agnes Ramphal, my cousin, watching all the way from Guyana. We have Bibi Amina Ratmatullah watching. She's somewhere in the studio. I don't know which part. And one of the things I've always said, Bibi Kandaya watching. We went to Lenore Presbyterian Church together. Always special to my heart. It's good to have you on, my dear. And good I get a sneak and see some of you. So it's good to have you guys on. And one of the things that I've always let you guys know is how much I appreciate all of you. And last night I was at Shana's birthday party, and there was this singer that was there, and he says, you know, I always watch you, but you'd never say shout, you never shout me out. And I was like, oh my God, I'm sorry, I apologize. And one of the things that I always feel bad about is that after the show, one of the things I've always does is to go back and see who was watching my show. And sometimes you see I say thanks for watching the show. Is that because I didn't think that I call your name? But one of the things I want you guys to know is I appreciate all of you and how valuable you are to the Ken Rampersaud Show. Without you, I am nothing here today. But breast cancer risk reduction for women with high risk. If your doctor has assessed your family history and determined that you have other factors such as precancerous breast condition that increase your risk for breast cancer, you may discuss options to reduce your risk, such as preventative medication. And yes, you can take medication to prevent breast cancer, reduce the risk of breast cancer in women with high risk of the disease. The medication carry a risk of side effect like any medication you take. But one of the things I always tell people, you always want to educate yourself, read up on things and read up on medication, but don't get too excited. If there is a particular side effect that you don't like what you're reading, please, by all means, talk to your doctor, talk to your pharmacist. That does not mean, and I'm saying this, I'll tell you why. that does not mean that you are going to go through that side effect that's stated on the box or on the medication. A lot of times patients come to me at work and they will say, oh, I'm not going to take an aspirin because aspirin is going to make me bleed. And, those are messages that being put out there so that, nobody would sue them and all these kind of things. But one of the good things is that aspirin is a blood thinner and it helps you prevent heart attack and so on. So make sure you talk to your doctor, and the more education you have is the better for you. That will be your best tool and your best defense. If you get diagnosed with breast cancer, you want to go read as much as you can, so when you go to your doctor, you will get all the information that you need. The medication carries side effects, as we know, so doctor reserve these medications for women who have a very high risk of breast cancer. Discuss the benefits and risk of your doctor. Preventative surgery. Women with a very high risk of breast cancer may choose to have their healthy breast surgically removed. They may also choose to have their healthy ovaries removed to reduce the risk of both breast cancer and ovarian cancer. And this was a surprise to me. I would say to myself, why would someone want to take their good breasts out, and they don't want to get cancer? But the thing is that they don't want to get cancer. That's the real deal about it. Their chances of getting breast cancer is very high. But I've always tell people, what do and what the doctor advises you to do. That's one of the best thing you can do. Also, some people, they get cancer, let's say on the right side of the breast, and what they do, they would go and take out both breasts. So because they're worried that they will get cancer on the right side of the breast. So you will need to have a good discussion with your doctor and therapist to know what to do. Also, diagnosis. Before the exam, your doctor will check both of your breasts and your lymph nodes. And we have some lymph nodes down under our armpits. Okay. Also, we talk about the mammogram. You want to know the mammogram actually is an X-ray of the breast. Mammogram are commonly used to screen for breast cancer. If any abnormality is detected on a screening mammogram, your doctor may recommend a diagnostic mammogram to further evaluate your breast cancer. Also, breast ultrasound, ultrasound used like the waves to produce images of structures deep within the body. Ultrasound may use to determine whether a new breast lump is a solid mass or fluid cyst. Okay, removing the samples of your breast cell, which we call a biopsy, and a biopsy is the only definitive. That's the best they can do way to make the diagnosis of breast cancer, where they go and they take a piece of the tissue out during the biopsy. Like your doctor will use a specialized needle device guided by X-ray or another image test to extract a core of tissue from the suspicious area. Often a small metal marker is left at the site within your breast so the area can be easily identified on future images test. Biopsy samples are sent to the lab for analysis where experts determine whether the cells are cancerous. A biopsy sample is also analyzed to determine the type of cells involved in breast cancer, the aggressiveness, grade of the cancer, and whether the cancer cells have hormones receptors or the receptors that may influence your treatment options. And when we talk about treatment options, a lot of times I'm saying that, the best thing to do is to sit with your doctor and ask them what is best for you, what's the best treatment option you have, whereas you just take medication, you do surgery, whatever you do to get that breast out of the cancer out of you. Also, we have the MRI, and a lot of times you can go and do an MRI. Your doctor may order MRI, which is a good thing to do, and that will see exactly what's going on there. A machine that's used to magnet and radio wave to create pictures of the interior of your breast. Before a breast MRI, you receive an injection of dye. Unlike other types of imaging tests, MRI doesn't use radiation to create the imaging. Other tests and procedures may be used in depending on your situation. And I have to tell you this about MRI. A lot of times, I'm so glad now that they have open MRIs, because before you have MRI where you go, my God, you get scared of there, especially if you're claustrophobic. It was a scary thing, so I'm glad that now you can do open MRI. And I want to talk a little bit more about mammogram. A lot of times we go to the doctor and we hear that they want to do mammogram and we don't know exactly what's going on. And I want to talk about just this one because it's related to the breast. Mammogram, which is a breast X-ray, are the best screening tool we have to find the breast cancer early when it may be easier to treat. After you and your healthcare professional establish a screening schedule, it will help to know help you to know what to expect and for things to go as smooth as possible. We know a mammogram is an X-ray of the breast that used to find breast changes. X-ray were first used to examine breast tissue nearly a century ago. Things have changed now. Today, an X-ray machine used for mammogram produces a low-energy X-ray and exposes the breast to much less radiation compared to those in the past. Also, having all your mammogram at the same facility, I want to tell you, when you're doing a mammogram, please go one place and do your mammogram. Also, and I'll talk a little bit more about that, you want to keep one doctor who follows you. You don't want to jump around the place. You go this month to one doctor, then you go to another doctor. It's not a good practice. You want to have one doctor that's good, who you trust, who you can put all your trust in, and you believe in them. That also they're going to do your mammogram. Make sure, you know what a good thing to do too, and that I always do, is that try to get hold of your mammogram and keep it with you, that in case you have to move around, you take your mammogram with you. Also, a good thing to do, your doctor will it's always help to have a baseline of your mammogram. So if you do a mammogram, let's say in Queens today, next year when you have to do another mammogram, do it right at Queens. So they can compare the results and they would help you much more. Rather than running around the place, you do one in Queens today, then next year you do one in Brooklyn. There's no comparison. You can't compare the results, okay? And it's best known to schedule your mammogram about a week before. Listen to this very carefully. It's best to schedule your mammogram about a week after your menstrual period. Your breast wouldn't be as tender or swollen, which means less discomfort during the X-ray. So let me repeat that again. The best time to schedule your mammogram about a week after your menstrual period. Your breast wouldn't be as tender or swollen, which means less discomfort for you. Okay, so that's a good point. When I was thinking, what do I say to you guys? And then the other thing is, I'm going to say, what do you wear when you go to the doctor? You want to wear clothes that's good, easy to take off. You don't want to wear, Lord, all these fancy clothes. You want to wear something that you could use a zip to take off your top. It's best to schedule a mammogram. You wear two-piece like a top. You have something. You have a skirt and a top. Also, another important thing. I'm so glad I'm saying this, and I hope that you guys are embracing. Do not apply deodorant, antiperspirant, powder, lotion, or ointment around your chest area on the day of your mammogram. This can produce like a white spot on your chest, on your mammogram. Again, I'm going to repeat this again. Like I said, being a nurse and a layman, I am looking for pointers. How can I help you guys get information to help you? Again, when you're going to go for your for your mammogram, please do not try to powder up the place. Don't use antiperspirant, powder, lotion, ointment around your chest area. Try to leave it just like that, because when you do the mammogram, what would happen? You will see spot on the X-ray, and your doctor will have to send you to repeat another test, another mammogram. So that's a good tip. I think that's good for you guys to know. Also, and that will help them to get a very clear view. The entire procedure will take like 20 minutes or so. The breast is compressed between two plastic plates for a few seconds while X-ray is taken. and I know sometimes it could be very uncomfortable. It's reposition and compress again. It takes another side of the view. This is when, and this is done on the other side of breast. Flattening the breast can be uncomfortable, but it's need to be done so that the doctor can get a good view of the mammogram that you're doing. You should get your results within 10 days. Also, I like to tell you that if your doctor sees something that's draw their attention, they may want to call you earlier to repeat the test again or to do further investigation. Also, I want to tell you guys, October month of each year is National Breast Cancer Month. I want to tell you that for uninsured or low-income women, free or low-cost mammogram services are available. Some of these mammograms are held during National Breast Cancer Month in October again, while others offer year-round. You can always call the American Cancer Society if you're living in the United States at 1-800-227-2345 to find a program near you. Again, if you don't have money, you can't afford to do a mammogram, always call the American Cancer Society at 1-800, and I'm going to ask my DJ to get another song for me while I'm going to read out the number. The American Cancer Society at 1-800-227-2345, and they can help you get a low-cost mammogram or help you to get one. It will be a very sad thing that if you see that you have some lump in your chest area, in your breast, and you can pay to get a mammogram done. So to find out what's going on. Again, you're watching the Ken Rampersaud Show here on Island Zone Radio. I hope that you are enjoying this program, or at least it's informational. You're getting a lot of information that will help you tonight. Let's go, DJ. Good evening to Roxanne Walker Hamilton.
She only want me to be she Raja. I bounce up with this young girl by me Aja. Now she only want me to be she Raja. It was a celebration and she come out to line. And when she spot me, she walk and she whine. I bounce up with this young girl by me Aja. Now she only want me to be she Raja. Yes, she only want me to be she Raja. She want me be she Raja. Hello?
Hi, baby. How are you? Pate! Ako kaya na ba?
A pandit coffee book on Sunday for tomorrow, 10 o'clock. She think I got plenty money, she would not leave me alone. All day and night, she just a ring down my phone. She trying really hard, boy, to
Well, well, well. She want me to be Shiraja. Good evening and welcome back to the Ken Rampersaud Show here on Island Zone Radio. It's good to have you guys on. I'm going to answer what's her name question. Priya said, what age is required to do a mammogram? The American Cancer Society recommends women at average risk of breast cancer should get one yearly at age 45. Then every other year, starting at age 55, the society also suggests women could choose to have mammogram as early as 40, especially, my dear, if someone has a very strong history of breast cancer in the family. That would be a great thing to do to start early o'clock. The best thing to do is talk to your doctor, and they will just tell you, not just tell you, they will advise you on when you should really get your mammogram. So, as again, speak to your doctor and don't hold back any information when you are speaking to your family, and get as much information as you can get in terms of breast cancer in your family when you're going to your doctor, so that you may be able to give them these information. And we want to know operation used to treat breast cancer includes, and we talk about removing breast cancer, lumpectomy, during the lumpectomy, which may be referred to as a breast conversing surgery, or a wide local incision. This surgeon removed the tumor and the small margin of surrounding healthy tissue, and that's one of the lumpectomy. That's what they do. A lumpectomy may be recommended for removing smaller tissue tumors. Some people with large tumors may undergo chemotherapy before surgery to shrink a tumor and make it possible to remove completely with a lumpectomy. So again, we learned that if you have a big tumor, what your doctor can do is to give you some chemotherapy, and what would happen is will shrink that tumor. Your doctor will go in there and just take that out. Also, removing the entire breast, which is a mastectomy, is an operation to remove all of the breast tissue. And one of the things that I really want to talk about, which I probably wouldn't get to do this week, but I will definitely want to continue this discussion next week. I know that when a woman do have a mastectomy, where she remove one side of one of her breasts or both of her breasts, it's a problem. She will endure a lot of problems. She can be depressed. It has to do with her body image. But like I've always said, man, if your partner love you, they will accept you for who you are, not just for your breasts. So next week, I would want to bring back this conversation. I want to talk about next week, how do we help our partner, our wife, to deal with this? Because we know it's a big thing. They can get depression and so on. And also, we want to talk about husband. How do we deal with our wife when she diagnosed with cancer? How do you help your wife deal with this? And I know in a loving relationship, both husband and wife can go through this with a little ease, knowing that there is a lot of love. So this is one of the things I'll be talking about next week. How do we help our partner? Also, as you know, that sometimes for the husband or your partner, it could be difficult to have someone with cancer. How do you deal with that? So next week, I'm going to see if I can put at least 1 hour of that discussion. Neurosurgical techniques may also be an option in selected cases in order to improve the appearance of the breast. Also, we know that they can do breast reconstruction, which is a good thing in this time. Skin separating, skin sparing mastectomy and nipple sparing mastectomy are increasingly common operation for breast cancer, removing a limited number of lymph nodes to determine whether cancer has spread to your lymph nodes. Your surgeon will discuss with you the role of removing lymph nodes that are the first to receive the lymph drainage from your tumor. If no cancer is found in those lymph nodes, and that's a good thing, the chance of finding cancer in any other remaining lymph nodes is small, and no other lymph node may be needed to be removed. And that's why I'm preaching that the best thing to always do as a, you go reach 40, 50 years old, always get a baseline of what your breast should feel like. It's a good thing to do. As we said, early detection is the key. Removal of several lymph nodes. If cancer is found in the centennial lymph nodes, your surgeon will discuss with you the role of removing additional lymph nodes in your armpit. Like I said, some of these things when I was reading and decide what I will talk about, like you don't need to know all of this. I didn't want to talk about all of this, but it's good to know. And so when you go to your doctor, you'll be able to ask any question you want, which will help you. And as I said before, that some women, I'm not sure if Angela Jolie, Lord, and I'm not calling her name negatively, so I don't want a problem, But I think that I heard that because of her strong breast cancer history, she had removed both of her breasts. Some women with cancer in one breast may choose to remove both breasts, even to the healthy breasts, if they have a very increased risk of cancer in other breasts because of the genetic predisposition of family history. And like I said, yes, maybe a good thing to do if you have one of your breasts already has cancer and you're comfortable in your own skin, that you want to remove the other breast, might be one of the best things that you can do for yourself. Also, a good thing to do is to talk to your partner, whether your husband or even your wife. As you know, men do get breast cancer. You guys sit down and talk about it and what's the best option for you. And you will have a clinical team. They will help you. They will advise you what to do. Most women with breast cancer in one breast, I said, will never develop cancer in the other breast. So there's a chance that you're not sure if you're going to get it. Discuss your breast cancer risk with your doctor, along with the benefits and the risk of this procedure. Complications of breast cancer surgery depends on the procedure you choose to do. Breast cancer surgery carries a risk of pain, bleeding, infection, and arm swelling. You may choose to have breast reconstruction after surgery, and I know that a lot of women choose to do these kinds of surgery sometimes. So, it all depends on how much money that you have that you can do. As you know, people have healthy breasts, and they still go and do things that would help them to enhance their breast, okay? Also, whenever you go into a doctor, you want to get referral from someone who you know of a surgeon before you go and do any kind of breast surgery. Your options may include reconstruction with breast implant with either silicone or water, or reconstruction using your own tissues, that they could take tissues from your butt or your thigh. These operations can perform at the same time of your mastectomy or at a later date. If you're a strong person and you know that your body can withstand all of that, the best thing that you can do is probably get everything done at one shot. But then you have to get a cardiac clearance. Make sure that you have a strong heart, that you can endure all of this. Also, we want to talk about radiation therapy. Radiation therapy uses high-powered beam of energy, such as X-rays and protons, which will kill the cancer cells. Radiation therapy is typically done using a large machine that aims the energy beam at your body. But radiation can also be done by placing radioactive material inside of your body. And I have heard of this, of a friend who had prostate cancer, and they've done this for him. Also, breast radiotherapy may be an option after a lumpectomy if you have a low risk of cancer recurrence. Doctors may also recommend radiation therapy to the chest wall after a mastectomy for large breast cancer. So, or cancers that may have spread to the lymph nodes. Breast cancer radiation can last from 3 days to 6 weeks, depending on the treatment. A doctor uses radiation to treat cancer, that we know that they are called radiation oncologists, determine which treatment is best for you based on your situation, your cancer type, and the location of your tumor. Again, guys, you will have to believe and trust in the doctor that you are going to, so they would help you. And I've always said, if you have a good, strong family, you have your husband, you would want to take him with you, or he may want to go. The best thing to do is he would go with you and give you all the love, the emotional support that you will be going for. Side effects of radiation therapy include fatigue and a red sunburn like rash, where the radiation is aimed at. Breast tissue may also appear swollen or more form. Rarely more serious problems may occur, such as drainage to the heart or lungs, or very rarely second cancer in the treatment area. Let me say hello to some of our viewers, and when I finish that, I'm going to ask DJ to play another song for us. Ladies and gentlemen, you are watching the Ken Rampersaud Show. Let's see, we have Leela, thanks for watching the show. Chaitram and Ronnie Narayan, thank you for watching. My good friend, always nice to hear how you says to my good friend Ken, a very pleasant good evening to you, Joy Rambaran. Hope all is well. Pamela Sinarine, thanks for watching. Anita Diaram, thank you very much for watching. Bibi Hack, it's good to always have you on. Hazel and Gordon, thanks, it's good to have you on. Sheila Singh, thanks, it's good to have you on. Lal, thanks for watching. Vidya, thanks for watching. I hope that at least that you guys can learn something from this. And at the end, I'm going to talk about some things that I'm going to try to wrap things up and let you guys know what's something that you can do. And my good friend again, Miss Shamira Kimball, I know she probably take a shot because she passed her nursing exam. Kumkaran Ramdas, what a strong name. Good to have you on. Neela, thanks for watching again. Charda Budu, watching all the way from Wisconsin. And I have to say a special thank you to Charda Budu. This past week, she sent me about 5 that she sent me. She sent to Gita, to our family, about 5 different pepper sauce, achar, mango, and then she sent some black cake for us. So, my dear Charlotte, I want to say thank you very much for being kind, for being good at your age, for still doing all these fantastic things. This evening, I'm going to taste some of that black cake. I hope you made it with a lot of love, and I will enjoy it. And thanks for inviting your friends to watching the Ken Rampersaud Show here on Island Zone Radio. Anita, my sister, always, she says good information. Susan Martin, good to have you on. You guys could tell me where you're watching from, and so I can big you up, Guy. I love to hear where you guys are from. Trinidad, Barbados, wherever you are. I heard that some people are watching me from India. To those guys, I want to say shukriya. Please continue to share the Ken Rampersaud Show here on Island Zone Radio. Let's go, DJ. You're watching the Ken Rampersaud Show here on Island Zone Radio.
Boy, Tony comes in the Shakti String Studio. She light up the fire, put on the tawa, never making a roti for me. She own me a bere, she like to seke, ye roti mere liye. She lights up the fire, put on the tawa, never making a roti for me. She own me a bere, she like to seke, ye roti mere liye.
A very pleasant good evening to the man himself, Mr. Robert Lynch, watching all the way from Georgetown, Guyana. Kamlade Lalchen, thanks for watching. Ariella Singh, beautiful name. Leela, thanks for watching. Good evening, Amila Kotwaro.
She only a bele bele she like to sing yeah, roti mere liye.
Welcome back to the Ken Rampersaud Show here on Island Zone Radio. The show airs every Sunday afternoon from 5 p.m. to 7 p.m. Eastern Standard Time here in New York. Let's talk about some chemotherapy. We are talking about breast cancer today. Also, we want to talk about chemotherapy. Use drugs to destroy fast-growing cells such as cancer cells. If your cancer has a high risk of returning or spreading to other parts of your body, your doctor may recommend chemotherapy after surgery to decrease the chance that the cancer will occur, because sometimes they could miss a cancer spot, so that's why they would want to give chemotherapy. Chemotherapy is something sometimes given before surgery in women with large breast tumor. The goal is to shrink a tumor to a size that makes it easier to remove with surgery. Chemotherapy is also used in women whose cancer has already spread to other parts of the body. Chemotherapy may be recommended to try to control the cancer and decrease any symptoms and the cancer may have been causing. Chemotherapy side effects depend on the drugs you receive. Some of the common side effects are hair loss, nausea, vomiting, fatigue, and the increased risk of developing any kind of infection. As we know that sometimes you take chemotherapy, sometimes it kills some of the good bacteria in your body, so you're susceptible to get some kind of infection. Also, rare side effects can include premature menopause, infertility if menopausal, damage to the heart and kidney, nerve damage, and very rarely your blood cell cancer. Also, we're going to talk about hormone therapy. Hormone therapy, perhaps more properly termed hormone blocking therapy, is used to treat breast cancer that are sensitive to hormones. Doctors refer to these cancer as estrogen receptors and progesterone receptors cancers. Hormone therapy can be used before and after surgery or other treatment to decrease the chance of your cancer returning. If the cancer has already spread, hormone therapy may shrink and control your cancer. The treatment can be used in hormonal therapy include medication that blocks hormones from attaching the cancer cells, medication that stop the body from making estrogen after menopause, surgery, or medication to stop hormones producing in the ovaries. Also, hormone therapy side effects depend on your specific treatment but may include hot flashes, night sweats, and vaginal dryness. Most serious side effects include the risk of bone thinning and blood clots. So we want to make sure that you follow up with your doctor and for them to advise you what the best thing to do. Also, we have target therapy drugs. Target drugs treatment attack specific abnormalities within cancer cells. As an example, several target therapy drugs focus on the protein and some breast cancer cell overproduce called human epidermal growth receptors, which is HER2. The protein helps breast cancer cell grow and survive by targeting cells that makes too much of HER2. And like I said, you probably don't need to know all of this, but I'm just saying the drugs can damage cancer cells while sparing healthy cells. Target therapy drugs that focus on other abnormalities within cancer cells are available, and target therapy is an active area of cancer research. Your cancer cells may be tested to see whether you might benefit from target therapy drugs. Some medications are used after surgery to reduce the risk that the cancer will return. And that's a sad thing that one has to live with, to know if their cancer is going to return. It's not a good way, but I'm sure that with therapy, with love and everything else, that you can continue to live a good life, a productive life. Others are used in case of advanced breast cancer to slow the growth of the tumor. Also, we talk about immunotherapy. Immunotherapy use your immune system to fight cancer. Your body defense immune system may not attack your cancer because the cancer cell produce proteins that binds the immune system's cells. Immunotherapy works by interfering with this process. Immunotherapy is another option. You have a triple negative breast cancer, which means that the cancer cells don't have receptors for estrogen, progesterone, or HER2. For triple negative breast cancer, immunotherapy is combined with chemotherapy to treat advanced cancer that spreads to other parts of the body. And like I said to you guys, I'm just saying this to you guys, you may not need to know all of this, because when you go to your doctor will tell you all of these things and will discuss all the treatment options you have. And on some of the signs and symptoms after your surgery, you will experience some pain, loss of sensation to the chest or remaining breast tissues, a type of swelling called lymphedema, after having radiation therapy, or lymph nodes removed during surgery. Lymph fluid can start building up under your arm, hands, and your breast or torso, and you really don't want that. With chemotherapy, you will get nausea, mouth sore, you will get hair loss, high risk of infection, reduced appetite, and or low loss, weight loss, brain fog, or trouble with concentration, with memory. And next week, I hear talk about you will get mouth sores and so on. Also, if you get bald, what some of the things that you can do, we'll talk about it next week. I know that some people put on their wigs, they buy wigs and use it. Also, some partners, they shave their head to coincide with whatever their partner is going through. And I say partner because, in today's society, you have, in gay relationship, you have two female, and I'm just mentioning it, that's why I'm saying partners. Hormone therapy, you have headache, hot flashes, mild nausea, vaginal dryness, vaginal discharge, hot flushes, night sweats, increased risk of blood clots, mood swings, and next week we're going to talk about a little bit about sex too, because we know that when you go through any kind of chemotherapy, when you have cancer, you are sometimes at your low. Having sex is on your last thing on your burner to do. So we will talk about that next week. We will talk about your partner, how to help them cope with you having been diagnosed with cancer. Especially you have young children, target therapies, you have fatigue, hair loss, mouth sore, nausea, increased cholesterol and or blood sugar, increased risk of infection, heart problems. Side effects of breast cancer treatment can be pretty unpleasant, but these days doctors have a lot of ways to help ease, from anti-nausea medication to one that boosts your immunity. Don't worry about putting up with a brave front. If you are struggling with symptoms, let your doctor know so that they can help you find some relief. And it is true, it's a true statement that if you are going through a lot of experiencing a lot of signs and symptoms, you would want to let your doctor know so that your doctor will be able to help you. We know that living day to day after being diagnosed with breast cancer can be full of fear and anxiety, plus pain or other real not fun side effects from treatment. You may also have to deal with people who don't understand the condition and can fully grasp what you're going through. But there's a good news, because breast cancer is relatively common. A lot of us know there's so many treatment options there is out there. And like I said before, you want to talk to your doctor. We're going to get DJ to play another song for me. And when we come back, we'll wrap this show up, and I'm going to talk a little bit more about breast cancer, of how much people get it. Okay, let's go, DJ. You're watching the Ken Rampersaud Show.
Put your hands in the air, go up. Let me see your hands go up.
घर के मेरा दिल बस तेरा ही गाना बस तेरा ही गाना घर के मेरा दिल बस तेरा ही गाना बस तेरा ही गाना बजाते ही तुम रहना
बांसुरिया फिर से बजाओ सैया बांसुरिया फिर से बजाओ
बांसुरिया
Good evening to Sabita Devi, listening all the way from Toronto, Canada. Underground Sounds. Schenectady, New York. Jayasri Sarju, always good to have you on. And that's right, that's DJ Bolt playing for me today.
बांसुरिया बांसुरिया फिर से बजाओ साजन बांसुरिया फिर से बजाओ बांसुरिया फिर से बजाओ साजन बांसुरिया फिर से बजाओ
बांसुरिया फिर से बजाओ सैया
Ganika Singh, Sunny Char, Centura watching all the way from Canada. It's always good to have you on, Ganika. Leela Singh, thanks for watching. Brooke Yelena. Oh my, Brooke is on. I'm glad to have Brooke on the show tonight.
love his music. Been in my life.
You are watching the Ken Rampersaud Show here on Island Zone Radio. Ladies and gentlemen, I want you to big up Brooke Yelena. Do not. I will be interviewing her the first week of November if all goes well. She was very, very sick with the COVID-19 and she was intubated in the and was in the hospital for actually I think sometime during a month. You will get all the details when I interview her. We will be talking about the coronavirus. So good to have you on. I have to start preparing your questions I have for you, Miss Tudnat. So I'm glad that you tune into the show tonight so I get to say hello and hi to you. Again, guys, Brooke was very sick with the coronavirus. Her doctor told her that she was not going to make it, and that's what they told the husband. Thank God she made it. And you guys will hear from us the first week of next month. I'll be interviewing her on the Ken Rampersaud Show. Narain, thank you very much. Shamati Narain, thanks for watching. Ganika again, thanks for watching. Barbara Bond, thanks for watching. Sanita Chitram, thanks for watching. Deepa Dasrat, watching all the way from Florida. It's good to have you on. She said, hey, good evening to you and the viewers and your family. She is from Lenora, but watching. Iqbal Sharif, it's always good to have you on. I know your name for a long time. Your name is synonymous, Iqbal Sharif. Indra Singh, Banu, thank you very much. My Dolly Lilauti Ramu, thanks for watching. Bibi Fazila, thanks for watching. Harichen Narain, thanks for watching. Katwaru, thanks for watching. I'm reading fast because I know time is coming up where we have to say good night. Also, let's say, and guys, I am so glad that all of you are watching the Ken Rampersaud Show here on Island Zone Radio. You know, one of the things, and I see one of the Mary Ann Lou said, thanks for your time. You know, Mary Ann Lou, one of the things that I've always do is, you know, I've been a nurse for a long time here in the United States and Guyana. I started my nursing journey in 1985 at the Georgetown School of Nursing in Guyana. And when I came to the United States, I spent many years in New York, in Harlem, working with the poor, the underserved, and I was wondering to know how I can help our community and our people. And I'm so glad that because of Shanaz Hussain, the Caribbean Voice, they have given me a platform to where I could come and talk about all of these things here and give me a platform so I could talk to you guys. So I'm glad, please. And the other thing is that I know Mary Ann Lou said thank you. And you know, one of the things is, yes, it's a lot of work, but I really love doing this show, and and I'm just like any one of you guys. So anytime you see me, you just say hello, hi, whatever it is. I'm just a normal person. I like when Alvin says, Ken to the world. Ladies and gentlemen, we are talking about breast cancer, and we know that men and women do get breast cancer. Any one of us can get it. 1 in 8 women in the United States will develop breast cancer in her lifetime. We know that 1 in 833 men will get breast cancer. We know every year approximately 520 men is expected to die from breast cancer. 1 in 10 women diagnosed with breast cancer is under the age of 45. We also know that breast cancer mortality rate has been decreasing since 1989, and that's one of the good things because people are listening, people are checking their breasts, they're doing early intervention, they're going to the doctor early. We know more than 2.8 million Americans living in the United States are breast cancer survivors, so we know that people get breast cancer and people are surviving from breast cancer. Act Now, breast cancer education and screening can save up to 37 lives every day in the United States. So we have left 2 minutes more to go. And next week we are going to talk about, because I know that breast cancer can be very difficult for the family, could cause the whole family so many problems. Next week I want to spend the time to talk about how do we help our spouse, our partner, our wife, if they have been diagnosed with breast cancer. Also, if your husband gets breast cancer, what can we do? How can we help them? How can we help each other? So this week I'm going to do all my research and see how best we can do it. Again, we never know what could happen, what tomorrow brings for all of us. And so let's be kind to each other. I hope the week brings a lot of good things in our lives. And again, guys, be very careful with the coronavirus, as we know that it's coming back in the United States and around the world. Please make sure you wear your mask, you practice social distancing, you wash your hands for at least 20 seconds. All right, if you don't have to come out of the house, please don't do so. No, you know, like somebody was telling me, you are immune to the coronavirus. From what I was told, for about 3-4 months, you are immune, but you can be a healthy carrier where you can you can take the coronavirus home or to elsewhere. So ladies and gentlemen, I am so glad to have all of you guys. For all of you who have been watching the show, sharing the show, I say thank you. A lot of you guys don't say anything, you stay quiet in the background. I want to especially say thank you to all of you guys for sharing the program and for helping your friends, your neighbors get the knowledge. I am trying my very best. I am not an expert in any of this, but because of my experience and being a nurse, I can be able to help and share this information with you guys. Also, we want to continue praying for Miss Maria Harris' father, who is not doing well in Guyana, and also DJ Fest's grandmother is not doing very well. So let's keep them in our prayers and pray that their family will heal quickly. On behalf of myself, DJ and the Selector Bolt, as you guys know, this show is about me and him. We bring this show every week to you guys. He plays the music, I do the talking. He is shy, he don't want to come on the radio, or else I bring him on the radio, so you guys would get to see who he is. Probably another day I could get him on, so you guys could get to see him, and I'll do the talking. He probably wouldn't want to say anything. Again, ladies and gentlemen, thanks for watching the Ken Rampersaud Show. Until next week, do have a very, very pleasant evening. Until then, have a good night. Let's go, DJ. Community Sing, thanks for watching the show. Pause. Zena, thanks for watching the show. Devika, I hope you plan to come back sometime soon on the show. My viewers would like to know when you're coming back. Elsie Roxanne Ross, thanks for watching the show. Again, guys, some of your comments I don't get to see till after the show. I am sorry. But always comment on the show. I will love to say hello to you guys. I want all of you to feel equally loved by me. And I want to say thanks to John from Queens for always putting my show on YouTube the very next day. You are watching the Ken Rampersaud Show here on Island Zone Radio. Until next week, guys, you have a very pleasant evening.